Hello and welcome to Seven Sentinels. This is Grandmaster class and I am the trainer Peter Simon with you. Today we are taking writing task. We are going to do two writing tasks. One is for the nurses and one for the doctors. First we are taking for the nurses and then we'll take for the doctors. Miss Mary Bell, Non-Insulin-Dependent Diabetes Mellitus. Today is a demonstration and we had number of students going for the exam. So we have new batch coming up, 1st of June. Mary Bell, Non-Insulin-Dependent Diabetes Mellitus. So here we are. Just go through the case notes. Go through the case notes. We are not learning the letter, we are learning the sentences, functions, how to write quality sentences, how to use passive voice, how to avoid personal pronouns, how to avoid irrelevant information, how to avoid redundant information, So let us take the information now. So we'll start from here. That's it. So we have the information. Now, what are the things that we have to gather here? What are the things that we have to gather here? This is equally important for the new students and the old students, whoever it is. Right. This is a lecture. Right. So the 7 components. Okay. The 7 components. Writing task. The 7 components. Now, what are the 7 components? The 7 components. Number 1, the address, the date, the salutation, the subject, the body, the leave taking or the closing, okay, and the sender's particulars. Yeah, these are the 7 components. These are the 7 components. Right. So these are the 7 components. Don't miss these 7 components. All of them must be there. Seven components must be there. So note down the points. Whichever you feel comfortable, note down the points. And if you miss anything, you can check it in the Telegram channel because they will be posted there. All this information will be posted there. Writing your notes is very important. So address. So these are the 7 components that we are going to take. Right. So how we are going to gather these 7 components? Now let us see. So the 7 components. So these are the 7 components. Right. Now, first one is the address. First one is the address. So, now how we'll find this information? Now first we'll go for the address. Now address will be here. You can see Miss Jane Rudick is also here. Miss Jane Rudick, community nurse, Newtown Community Health Center, Newtown Community Health Center, Newtown. So 4 lines are there. 4 lines are there. So this is the information that we have to take. So the address will be here at the bottom. So address is here. Jane Rudick, community nurse, Newtown Community Health Center, Newtown. So these are the 4 points which we have to take. So these 4 points. Yeah. So first we will starting with the address. So this is address. Miss Jane Rudick, remove comma, enter. Community nurse, enter, remove comma. Newtown Community Health Center, enter, remove comma. So this is how we are going to write. Yeah, 4 lines. This is the address. Then what you do, leave 1 line. Leave 1 line. So now we got the first one. That is this address finished. Address is done. Address is done. So okay. So we've taken the address. Yeah, that is done. Next, second one is what? The date. Now, where will we get the date from? So date is here. Discharge date, 15 July 2017. And nothing else, today's date is not given. So discharge date, 15 July 2017. So you can take that one here. So date. Date is this. Okay. Today's date. So 15 July. So that one line you have to leave. And again, 1 line you have to leave. Yes. So 15 July 2008, leave 1 line again. So second one is done. Date is finished. Now we'll go for salutation. So address is done. Then date. Date is also finished. Now we are going for salutation. Where will we get salutation from? Salutation you'll get from here. Address and salutation from there. First line. Miss Jane Rudick. Take this one. Miss Jane Rudick. So just here you use dear. Miss. Remove the first name. Dear Miss Rudick. Put a comma. Dear Miss Rudick. Put a comma. So that's done. Then again leave one line. Then subject. Now where is the subject? Go here again, subject. Subject is Miss Mary Bell. Miss Mary Bell, 66 years. So take this. So Miss Mary Bell. Yeah. Comma. Go to the beginning. So regarding Miss Mary Bell, aged 66. That's it. Leave one line. Now the body. So we'll leave the body now. Okay. So that's it. Mary Bell, 66 years. So aged 66. Right. Next. Body. After body, the closing remarks. So salutation done. Then subject done. Body. So body will do later. 5 paragraphs. So 5 question marks I put. Then the closing remarks. The closing remarks. Now here Miss Jane Rudick, name of the person is there. So here you will write, leave one line and write yours sincerely, comma. Yours sincerely, comma. Right. So this is also done. Body only we left. Okay. Right. Next one, the sender's particulars. Now let us check the sender's particulars. Where are the sender's particulars? Sender's particulars. You are a registered nurse working at Newtown Community Hospital. She is being discharged today. That means inpatient ward. Inpatient ward. Newtown Community Hospital, Newtown. So these are the 4 things that you will get. You can see here, registered nurse, Newtown Community Hospital, Newtown. Discharged today. So she is inpatient ward. She is in the inpatient ward. So yours sincerely. Here you leave 2 lines after yours sincerely. Then what's that? Registered nurse. Registered nurse. Inpatient ward. Inpatient is 1 word. Inpatient ward. Then Newtown Community Hospital. And it will be in Newtown. Newtown Community Hospital will be in Newtown. Now what is remaining? Everything is done. So Miss J, this is number 1. That is address. This is number 2. That is date. This is number 3. Salutation. And this is number 4. Subject line. Then body we did not do. Next is yours sincerely, closing remarks. Then 2 lines. Registered nurse, inpatient ward, Newtown Community Hospital, Newtown. See, I made a mistake. I can check. So it's very important. Checking and cross-checking is very, very important. So I made it a quick fix. I made it a very quick fix. I hope you understood all. From where we'll get what type of information. Yeah. So from where Dorothy, new student. Then next one, Chaitra, Dipana. Then, okay, Rins and K. Then, okay, these are the regular students. So I hope you understood the points which I have explained now. So other than the body, so other parts. So we can consider it as, so prefix, body, okay, or you can say three parts. Number one, you can say the starters. A, the starters. Then B, the body. And C, the desserts. You know, main course. The body is the main course. Okay, now we are going for the main course. B, the main course. So starters are the beginning, main course, then you will have an ice cream or something like that. That is the dessert. Okay. So this is how we are going to do. So the starters and desserts both are finished. Before the body, starters, after the body, desserts. So now we are going to the body of the letter. So now let me ask you a question. Is the information clear? Yes. Is the information clear? If it is a yes, say yes. If you have any doubts, just say what your doubt is type. I'm giving you just 20 seconds. So we are going to do 30 letters continuously from first onwards. Every day there is a letter. 30 letters. If anybody is interested in 30 letters course, you can request me. Or if you are interested for the regular course, all 4 skills also, you can contact me. 6 students went for the exam. So 6 places are remaining. We are going to fill in those 6 places. Yeah. Now we are moving forward to the body of the letter. Now let us see. Yeah. Next, body of the letter. Now you can see here, there are histories. Okay. Histories. Medical history, social history, family history. Medical history, social history, family history. Okay. Right. Medical history, social history, family history. So that is one part. Medical history, social history, family history. Then nursing management and progress. That is during the hospital, in the hospital, in the hospital, in the hospital. Then discharge plan after discharge. So there are 3 things: histories, nursing progress, and discharge plan. Discharge plan will be, okay, after discharge. Nursing management will be during hospitalization. And this is the general information: social history, family history, and medical history. Remember that. And diagnosis: unstable diabetes mellitus and small infected left foot ulcer, which is the main one, unstable diabetes mellitus. Secondary is small infected left foot ulcer. Don't take this small infected left foot ulcer to the introduction. Just write unstable diabetes. This is the most important problem. Unstable diabetes is not stable, so problem is there. So you have to stabilize. This is more important. This left foot ulcer is not that much serious. So this is more important. If this is not stabilized, she will be at risk. Okay, so this is the main point. So you write this point in the introduction. If you want to add, you can add this one secondary, but not this. Don't miss this. This is a must. Okay. So once again, so we have introduction, we have conclusion. So now coming to the body. So let us come to the body. The 7 components. The main component is the body. So here, the body of the letter. The body of the letter. The body of the letter, you have 5 things. The introduction. Okay. So main body paragraph 1. Main body paragraph 2. Main body paragraph 3. And then the conclusion. These are the main story. Okay, introduction is just introduction, conclusion is leave taking, finished. Okay, so here you can understand these are the 3 main things. So now this you can see what type of letter it is. You have to notice what type of letter. It's a letter of discharge. In discharge letter, discharge plan will come in the 3rd part. So main body paragraph 3 will be the discharge plan. Post-discharge action, we say. The discharge plan. Okay. Right. So you can see here the discharge plan. This will go into the last paragraph. What they have to do afterwards. What they have to do afterwards. And this is nursing management in progress. It will go into the 2nd paragraph. Okay. Right. So now this is not an urgent letter, a discharge. If it is urgent, means serious problem. No, serious problem is stabilized already. Okay, that's why she was joined, stabilized now. Okay. Then here you will have family history, medical history, and social history. Medical history, social history, medical history, social history. Background means history, and family history. Social history means his work and stay and other things. Family history, no relatives, no. So social history, no interest, no close friends. Family history, no relatives. Okay. Right. All these things. Fine. Now let us see the sample letter. So if you see here, now check it very clearly here. Okay, this is one sample letter, right? This is not A grade letter. This is just a B grade, not even B plus. Not even B plus. You can see 1 paragraph, 2nd, 3rd, 4th. Only 4 paragraphs are there here. Only 4 paragraphs are there here. We have to write 5 paragraphs. Okay. So Miss Bellard admitted for stabilization. This is okay. The next one, retired. This is personal social history. Right. And what should be done? That will go into post. So she will require ongoing management, regular saline lines. All these things will go into the last paragraph. Okay. All these things will go into the last paragraph. Yes. Fine. So Go through this letter 1 minute. So everything is there. You see, first address will be there. Many people write date first. I don't know why they write date first. Okay. I don't know why they write the date first. The date is second. First is address. First is address, then the date, then the salutation, then the subject line, then the body, then the closing remarks, yours sincerely, then 2 lines. See here, 2 lines. Then registered nurse. It's not nurse, registered nurse, you have to write. So even in the official letter, it is not clearly given. Registered nurse. Okay. So bother all these things. You have to be little cautious. Okay. So this is admitted. During admission, how the condition was. Then during hospitalization, what you gave. And after discharge, what is required. So 5 paragraphs you write. Fine. Okay. Now let us develop our story. So now you can see here what all are available here. So medical history, social history, family history, this will go into 1 paragraph. Nursing management and progress will go into 1 paragraph. And discharge plan will go into 1 paragraph. So which one should come first? So she was admitted. She was admitted. So here, first admitted to Newtown Community Hospital. So she was admitted, and from the time of admission, management. Then you can write about social, family, and other histories. So to whom are you writing? To whom are you writing? You're writing to the community health center. So they do not know about him properly. They do not know about him properly. So she is being discharged back. Okay. Newtown Community Health Center. So you can see lives alone. She lives alone. So they have to come here and support her. Okay. Lives alone. Right. Now let us see how we are going to develop this story. Right. I'll give you sentences now. Right. Let us see. Now this is a medium level sentence. You will not get a 450 for this letter. You will get 350 to 370, 380, maximum 390. You will not get 400 also. Right. So how are we going to do this? Now these sentences only we will take as they are. These sentences only we will take as they are. So let us take these sentences. 5 sentences. 5 paragraphs. Now let us take these sentences only without any modification. Now how can we develop these sentences? So body. The body of the letter. Here we are going to write. Yes. Now in this, we are going to write 5 paragraphs. You know what are the 5 paragraphs? I have already told you. The 5 paragraphs are here. So this is the discharge plan. This is, you can say, upon admission. Okay. So this is during hospitalization. So you can say she was admitted. So upon admission, how her condition was there? Upon admission. Or you can otherwise take during hospitalization. And here We can write histories, and then the discharge plan. So these 5 we will take now. Okay, these are the 5 things we are going to take now. Now, first let us take the introduction. Introduction, what are we going to take in the introduction? What are we going to take in the introduction? So in the introduction, there are some things which are very, very important. So number 1, the subject. So who is the subject? Who is the subject? The subject is Miss Mary Bell. So that is number 1, subject. And number 2, so what was her problem? The case. The case. So what is her case? Unstable diabetes mellitus. Unstable diabetes mellitus. We know the case here. Yeah. See here. Unstable diabetes mellitus is the main one. And second one is small infected left foot ulcer. So if you want to see, you can see in the letter. Okay. For stabilization, non-insulin-dependent diabetes mellitus. This is the main one. This can go into the introduction here. Subject is not given. Purpose is not there. Ms. Bell has been an inpatient at Newtown Community Hospital for the past 3 weeks. Where is the subject? Where is the purpose? Purpose is not there. Why are you writing this letter is not there? You think this is a perfect letter? They have given a sample. But where is the purpose? Where is the purpose? What she requires? Why are you writing this letter? What is her condition? Nothing is given. So how can you get 3 points here in this? Maybe you can get 1 point, but the purpose is missing and the present condition is missing. The reason for admission is missing. And why you are writing this letter is also missing. So all these are very, very important. So don't write the same thing and expect the same results. No. So these are the 5 things. Okay. So the subject is Mary Bell. The case, unstable diabetes mellitus. This is the main reason why she was admitted to the hospital. Okay. And what is the condition now? The type. The type of letter. The type of letter. The discharge letter. It's a discharge. Discharge letter. Discharge letter. So, Miss Mary Bell, and she had an unstable diabetes mellitus. Okay. So she was admitted for this purpose. She was admitted for this purpose, and now she is going to get discharged. And then the purpose. The purpose. What is the purpose? Why are you writing this letter? That means what she requires. What does she require? What do you want her? What is expected here? Monitoring. Regular monitoring. And encouraging, suggesting, encouraging, emphasizing, suggesting involvement, overall lifestyle plan. This is management of her condition. So the purpose is care and management. Okay. So ongoing care. Ongoing care and appropriate management. Following the discharge. Next one, the destination. Where is she going? Where is she going? Is she going to the care home? No. She's going to another hospital? No. She's going back home. Okay. Back to the pavilion. From where she came, there only she is going. Back home. And the time. When is the discharge scheduled? The schedule. When is she discharged? Today. Okay. So now, so background setting. So she has this problem. She has this problem. So, so unstable diabetes mellitus. The action taken. The action taken. What is the action taken? Stabilized. Condition stabilized. Condition stabilized. So these are the 7 points which you have to write. These are the 7 points which you have to write. So how are you going to write these 7 points into one sentence? Miss Bell, no need to write Mary again, because in here already we have said Miss Mary Bell. In the subject, already here it is their subject. So again and again, full name is not enough. Miss Bell, one time is enough. So Miss Bell, no need to write full name again and again. Miss Bell, who was admitted. So she was admitted for stabilizing, for the stabilization of diabetes mellitus. It was unstable diabetes mellitus. So for stabilization, she was admitted. So for stabilization, she was admitted. Now let us take all these words. Miss Bell. So we are writing the paragraph here. Miss Bell, comma, who was admitted. She was admitted to the hospital. Who was admitted for the stabilization of, why stabilization? Because it is unstable. So again, you need not write unstable. Miss Bell, who was admitted for the stabilization of diabetes mellitus, because it was unstable. Again, comma. Miss Bell, we got the point, Miss Bell, taken from here, who was admitted for stabilizing. Okay, condition stabilized now. Who was admitted for the stabilization of diabetes mellitus. So diabetes mellitus. So 3 points came here. Okay. Then what does she require? Requires. Okay. Requires. The purpose. This is the purpose. Requires ongoing care and appropriate management. Requires ongoing care and appropriate management following the discharge back home today. So you see all the sentences, all the points are going. Discharge letter, discharge has come. Discharge has come. Ongoing care and appropriate management. It has come. Where is she going? Back home. When is she going? Today. So you can see it very clearly there. Miss Bell, who was admitted for the stabilization of diabetes mellitus, requires ongoing. You will get 450 marks. 450 marks. Quality, 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 quality. Okay. So this is the introduction. Many people don't know how to write the introduction properly. So don't miss the sessions. I'm going to take 30 writing tasks daily. one writing task at 8 p.m. Indian Standard Time. And the letters are here. So Lionel Ramamurthy, Peter Dunbar, Jack Peterson, Patricia Stilesquist, George Gale, Miss Barry Bell, Margaret Helen Martin. So daily, this is first day, day 1. Okay, this is day 1, day 2, day 3, day 4, day 5, day 6, 7, 8, 9, 10, 11, 12, 13. So 30 letters from 1st June to 30th June, every day at 8 p.m. Indian Standard Time. All the regular students who have registered by paying the fees, don't miss the sessions from 1st onwards. Now also I'm teaching, okay. So now this is a regular session every day, 8 p.m. So I'll give you the schedule. You don't miss the sessions. 30 letters, awesome. No need more. That's enough. Every day I'll explain one letter. And for the doctors also, I'll give you a schedule afterwards. So, how many of you are seriously interested in these 30 letter sessions, lectures? 30 lectures, 30 writing lectures. If you are interested, type your name here. Okay? Or you can send me a message. So, yes. So you can just contact me personally, I'll tell you. So there are places only for 7 students. Copy link. Yeah. Ramandeep, you're a regular student, you must attend. You already paid. You're a regular student. Right. So contact me on this number. This is my WhatsApp number. Okay. So don't miss the session, 8 p.m. Indian Standard Time. Yeah, Chaitra Gowda, you are a regular student. You are not supposed to miss any session. You're already entitled for all these sessions. Right. The next one. So this is how you have to write the introduction. This is the introduction. How you have to write the introduction. This is very clear. So that is the introduction. Yeah. You can see there all the 7 points are there. This is a standard introduction. Write all the points which are related. Okay. All the points which are related. So 7 points must. Okay. Don't miss. Do not miss. This is the introduction. The next one. So if I'm taking doctor's letter also, nurses attend because it's all points, important points I'll be telling now. Next, I'll be taking a lecture for doctors. So in that also, I'll give you sentences, grammar, vocabulary, presentation, style, standard. All these things will come there. So do not miss. How to write a standard introduction is given here. That is the introduction. Right. Next one, body paragraph 1. Next one, body paragraph 1. So now you can write the sentences there. What you will write, you can write during hospitalization, admission over, already we have written admission. So during hospitalization, you can start. Second paragraph is during hospitalization. Yeah. during hospitalization. During hospitalization, then histories, then discharge plan. So this is with you. This is your work. During hospitalization, what you did. This is what you have to write now. During hospitalization, what did you do? During hospitalization, what did you do? Okay. During hospitalization, what did you do? Introduction is over already. Now we are going to the during hospitalization, what was yours? What happened? Build up a story step by step. During hospitalization, what you did, what medication you gave, what type of exercises you gave, what type of dressings you gave, how his condition improving. Okay, is he able to walk properly or not? During hospitalization, you have to explain everything. Where is that during hospitalization? We'll go there now. Okay, now we are going to during hospitalization. Now see here, this is during hospitalization. Okay, nursing management and progress. This should go there. This also should be managed. So now we can see here, right? So these are the histories. Okay. Now you gave medical hypoglycemic agent and it should be continued. Antibiotic therapy is given, that should be reviewed at the end of the course. Daily dressing changes are going on, you should continue those things. Okay, all these things we have done and you should continue these things. In addition to this you have to do. Okay, also this in addition. So this will go into first paragraph. This will go into first paragraph. So start with during hospitalization. Let us take these things. Okay. Right. So what are the things given? All these things we'll take. Now, let us, I told you, let us take from here the sentences. Okay. Yeah. Introduction done. Okay. Now here this is introduction finished. Introduction finished. Then we are going to body paragraph 1. The main body paragraph 1, the most essential one. MBP 1. Now what is this? This is during hospitalization. Course of action. Course of actions. During hospitalization, what you did. So during hospitalization, what are the things that happened? Now you can see here. So this is, Miss Bell has been inpatient. This is during hospitalization for the past 3 weeks. Okay. So this also we can continue into this. Okay. Miss Bell was admitted for stabilization of non-insulin-dependent diabetes mellitus. Okay, that's already taken. Okay. So this is already taken. So no need to repeat these things. Remove. So for which? For this only, no? She has been treated with oral anti-hyperglycemic agents. Okay. Now there are three things here actually you don't know. I'm going to tell you this one. Three things regarding medication. So medication. Okay. So during hospitalization, she has been an inpatient. We know she's an inpatient. That's why she's in the ward. So no need to write this one. She was admitted means what? Inpatient. Admitted means what? She has been inpatient. So why this? Not necessary. Remove. Not necessary. Admitted means inpatient. She's admitted means how can she be outpatient? No way. So not necessary. At Newtown Community Hospital, no need. Why? No need. We'll write in the end. Already wrote in the end, Newtown Community Hospital. You are writing from there only. So why do you want to repeat in the address? In the body? No need. You are writing from Newtown Community Hospital only. She did not go and join in some other hospital, from that hospital. So why do you want to write again that? No need. Okay. So for the past 3 weeks. Okay. During hospitalization, so start writing with during hospitalization. During hospitalization. Okay. During hospitalization. Okay. During hospitalization for the past 3 weeks, comma, I'm improving the quality. During hospitalization for the past 3 weeks. Okay. During hospitalization for the past 3 weeks. Finished. Okay, she has been treated with oral anti-hyperglycemic agents. Okay, see here. This is not for the past 15 years. Okay. So she has been hospitalized for the past 3 weeks. That is different thing. Okay. So try to understand this very clearly here. Try to understand this very clearly. So now, so for the past 3 weeks, no need. During hospitalization, okay. During hospitalization, that's enough. So how do we know that 3 weeks? What time she was admitted? What time she was? So that date you can put here. Was admitted. Here you can put the date. Who was admitted? When was she admitted? Take the date. She was admitted when? 24th June 2017. And today's date is 15 July. So it is understood that. So you just write here what? Who was admitted? Okay. On okay. On which day? 24th June. No need 2017. Because why no need 2017? Because already 15 July 2018. What is this? 15 July 2017, sorry. Yeah. So here, just write the date here. On 24 June. 24 June. Miss Bell, who was admitted on 24 June. Okay. Miss Bell, who was admitted on 24 June. No need to write 2017 again because already 2017 came here. Here it changed to July. That's why you are writing July. Okay. So 24 June is enough. Miss Bell, who was admitted on 24 June for the stabilization of diabetes mellitus. Okay. requires ongoing care and appropriate management following the discharge back home today. Right. So that's the so 24th June to 15th July, 3 weeks. So no need to tell that one. He can understand it very clear. Okay. So there itself, immediately after that one, here it is. Then, so during hospitalization, now, so the medications include non-insulin dependent diabetes mellitus. Okay. Non-insulin dependent diabetes mellitus. Right? Glibenclamide, metformin, among. I told you 3 types of names are there. One is glibenclamide, one is Glimel, and one is medical hypoglycemic agents or hyperglycemic agents. Okay, anti-hyperglycemic agents. So try to understand this, how you are going to write. So medical hypoglycemic agent is nothing but anti-hyperglycemic agents. So that is what he will write. See the sample letter, how nicely it is presented here, that particular thing. Oral anti-hyperglycemic agents. Oral anti-hyperglycemic agents. This is written outside because this is very important. This is very important, more important than glibenclamide or Glimel. More important. This is a special term. Okay, so use this term. Use this term. Okay, right. So the current medication during hospitalization, you write one sentence. What was done? The current medications include. She has been the condition. Okay. For the past 15 years, for the past 1.5 decade, for the past 1.5 decade, okay, the condition, again, the diabetes mellitus has been effectively managed with, okay, effectively managed with oral anti-hyperglycemic agents. This you can write in brackets, glibenclamide or Glimel, anything you can write. But glibenclamide is generic name, you better write brand name, Glimel. Okay. Right, better name is Glimel. These are anti-hyperglycemic agents or hypoglycemic agents. So, medical hypoglycemic agents or anti-hyperglycemic agents. So, it is bringing into hypoglycemic from hyperglycemic. Hyper means more. Okay, hypo means less. So glibenclamide is a generic name. Why do you want to write a generic name? Write Glimel, brand name. Brand name with a capital letter. Whenever the brand name is given, write brand name. For example, you are a nurse and your name is Pratiksha. Suppose. So, ordinary patients will call nurse. But the people who know you call Pratiksha. Even the patients who know you, they will call Pratiksha. They will not call you nurse because they are attached to you. They are well known to you. Okay, those who don't know your name, you have a brand name. Why do you want to be called as a professional name? Your family members, your teachers, your friends, they will not call you nurse. They will call you by your name. That is a specialty. You are branded with that name. There's a very special name. So when special name is given, why do you want to use the ordinary name? Okay, I'm giving you the important things. Let us take some people. Let us take Dr. Ahmad. Any other doctors are there? Muhiba. Dr. Muhiba is also there. Any other doctor is there? Okay. Now let us ask these doctors. Mr. Ahmed Abdullah Rashid Mansoor.
Yes, sir.
What do you think? Am I talking sense or nonsense?
Yes, sense. Very sense.
So when your name I know, I'll call you Ahmed. You are not doctor for me. I will not
Yes,
call you
sir.
doctor. I'll call you Mr. Ahmed.
Yes, sir. Is right.
Ordinary people call you doctor, but I am your teacher. I won't call you doctor. I'll call you Ahmed. Your father calls
Yes.
you Ahmed. Your mother calls you Ahmed. Your friends call you Ahmed. So
Yes,
you are,
because this
you
is
know
more
very
familiar.
well the medication. You know what type of medication you have been giving him. You know it's not just glibenclamide, any brand. No, it's particular brand called Glimel. It's a particular Dr. Ahmed. So doctor
Yes,
gave
sir,
me. Which
right.
doctor? Ahmed gave me. Got it?
Yes, sir.
Yes, Dr. Muhiba. I'm talking the doctor's language
Yes.
now.
Yes.
What do you say, Muhiba? Do you agree with me?
Yeah, definitely.
Which, see, I'm a patient. I will tell, doctor gave me medicine. Then you will ask, which doctor? Then I'll say Muhiba. Because I know the name. If I don't know the name, doctor gave me, some doctor gave me, that lady doctor gave me, the tall doctor gave me. Doctor only I'll tell. I will not tell the name of the doctor Muhiba. But if I know the name of the doctor, then I'll say Muhiba gave me. Clear. Finish. Close chapter. No more questions.
Yep.
So when you know the brand name, you have to write the brand name. And instead of metformin, not any metformin, it's Diabex. The brand is there. So that's very, very important. Whenever there is hypoglycemic agents, medical hypoglycemic agents, so here it is, medical hypoglycemic agents. This is anti-hyper, which is going hyper. So to remove anti-hyper, you have to give. She is now hyper, so you have to give anti-hyper. Anti-hyper is nothing but hypoglycemic. So how you are writing is more important. She is already hyper, you have to give her anti-hyper treatment. So medical hypoglycemic agent is nothing but anti-hyper. You are bringing blood to normal, hypo. So that's it. So this is how you have to write. So I'm teaching you A grade. If you cannot understand this one, it's okay. At least write B+. And don't write glibenclamide. Glibenclamide is a common name. You have to give Glimel. Don't write metformin. Write Diabex. Diabex is metformin only. Diabex is metformin only. But this is Diabex is a special name. It's not any brand. It's a particular brand called Diabex. That's it. All right. TDS. TDS, thrice daily. Glimel, once daily. So glibenclamide once and metformin twice, thrice daily. Glibenclamide 5 mg once and metformin, Glimel 5 mg once and Diabex 850 mg thrice daily. Both are daily only. So what daily will come only one time. And amoxicillin clavulanate. You write Augmentin Duo 4. This is brand name. Whenever brand names are given, write brand names. That's it. Because the person who is telling and the person who is listening both know what is Augmentin Duo 4. Both know Glimel. Both know Diabex because they are medical professionals. Right. Because the doctor believes in particular brand name. That's why he prescribed the brand. He did not just write glibenclamide. He said glibenclamide, but it's Glimel. When glibenclamide, Glimel is given, he cannot give any other brand. He has to give this brand only. Then, so you can write that one. So that's it. The condition has been efficiently managed with oral. but now it has become unstable. So that's why she was admitted, and anti-hyperglycemic agents have been given. Right. The next one. Okay. Augmentin duofortin. Augmentin duofortin. This is called antibiotic therapy. Right? Antibiotic therapy, no? Antibiotic therapy, special name. Okay. Amoxicillin clavulanate. That is generic name. Don't write generic name, write brand name. So instead of glibenclamide, okay, instead of glibenclamide, remove this glibenclamide. Remove this and write glimel. If you write glibenclamide, you will get B+. But if you write glimel, you will get A grade. Because you know the difference between brand name and generic name. Brand name is more important than generic name. You are writing a medical professional letter, so you have to know that brand name is more important than generic name. Teacher taught me. Which teacher? Simon Peter. Not any other teacher. Simon Peter taught this. When brand name and generic name are there, write brand name. Not any glibenclamide, but a particular glibenclamide brand, that is glimel and metformin. Why do you want to write metformin? Don't write metformin. Instead of that one, what you have to write? Okay. Diabex. Diabex. Write Diabex. He has given in brackets, particular brand. If Diabex is not there, give any other metformin. But I wrote Diabex. Why did you give some other medication? Oh, it was not there. Then you have to tell me, nah, I wrote Diabex. Why did you give some other brand? The doctor will ask you. If you are a pharmacist, doctor will ask, I wrote Diabex. Metformin I wrote, but I wrote Diabex. Then why did you give some other? XYZ. Doctor will be angry. What do you say, Ahmed?
Yes, sir. You
I'm
are right.
pharmacist.
Is this? Yes.
I'm pharmacist. You trust me that
You
you give some medications and I have to give accordingly. You wrote metformin,
Yes.
Diabex. Should I give
Yes,
Diabex or
generic.
can I give any other thing? If I don't have
No,
Diabex,
no.
should I inform you or not?
Yes, yes, you are right.
I should
You
take your
give
permission
the,
before giving some other brand. Yes or no?
yes, you should give the
That's it.
same brand.
You should know the powerful language. I'm talking to a doctor. Why I'm
Yes,
talking
you
to
are
a
right.
doctor with great command. See the way how I'm talking with power. The doctor has only
Yes.
one thing to say, yes, sir, nothing else. That is the language called powerful language. So, try to understand that one. And this type of treatment, metformin and glibenclamide, this type of treatment is called anti-hypertensive, anti-hyperglycemic agent or hypoglycemic agent or anti-hyperglycemic agents. And augmentin duoforte, amoxicillin clavulanate, amoxicillin and clavulanate. This is generic name. Augmentin duoforte is the brand name. But this treatment is called antibiotic therapy. It is called as antibiotic therapy. Bring it out. What type of treatment you are giving? Medical hypo and antibiotic treatment. So these are important. Focus on that one. And the medication is augmentin duoforte, right? Augmentin duoforte. See here, you can see here, glibenclamide he gave, but don't use glibenclamide. Glimel, augmentin duoforte, use it. Be careful what you're saying. The next. Right. Ulcer, daily saline dressing changes. Okay, that is one point. So first one is oral anti-hyperglycemic agents. Now, how do we come to know that this is oral? So from the medication, You see there. All right. So what are these? Orally. Orally, BD, twice daily. Augmentin duo-forte, twice daily. Orally. So oral. Oral medication. So one word oral has come there. So that is how, right here. TDS. Why this TDS is there in the official letter? Why it is there in the official letter? They say don't change it to the note form. From the note form, change it to the expanded form. TDS means what? Write down that one. Huh? BD, twice daily. TDS, thrice daily. Whatever it is, you have to write like that. Okay. So, for the past 15 years, I changed it to past 1.5 decade. Why I changed for the past 15 years is there. Why did I change? Because here also 15 years is there. Why are you writing as it is? Prove your English, na? Copy paste. What is the benefit? Show them that you are excellent in English. 15 years is equal to 1.5 decade. 10 years is equal to 1 decade. 1.5 decade. You are proving that your English is excellent, extraordinary. You can play with words. Why do you want to write copy paste 15 years? It is there in the case notes. Don't use whatever is there in the case notes as it is, unless and until it is compulsory. Unless and until it is compulsory. Do not use. That's the point. Do not use the words which are there in the case notes unless and until it is leaving you with no other option. Glibenclamide you should use, or Glimal you should use, or medical hypoglycemic agents you should use, or anti-hyperglycemic agents you should use. 4 words are there. Which one you are going to use? The most important is anti-hyperglycemic agents. Put it open. Then put the brand name in the box. Brackets. And don't carry the words TD and BD. Transform. You should know what they are. Learn. So first one is, so during hospitalization, what are the things? Okay, right. Number 1. Point number 1 is you're writing about anti-hyperglycemic agents. Anti-hyperglycemic agents. Okay, that is number 1. What is that? Put in brackets. Okay, what are they? Glimel, number 1. How much? Plus Diabex. So both you have to write. The next one is antibiotic therapy. Antibiotic therapy. That is what? Amoxicillin clavinolate. Okay, that is Augmentin duo-forte. Brand names only use. Augmentin duo-forte. Why people are eating 400 plus 450? Use like this. So this is the second point which you have to write. Okay. In addition to that, so this is one is over. That is first one. And next one, this antibiotic therapy for what? And this is for what? This is for diabetes mellitus. This is for what? This is for treatment of diabetes mellitus. And this is for what? This is for small infected left foot ulcer, a small. So you know now, first when you are talking about diabetes mellitus, what you have done, and infected foot ulcer medication. So first you are writing about medications. You are writing about medications. The next one. So medication is over. This is number one. This point is number one. This point is number one. Then this point is number two. So that is for the left foot ulcer. You can see here. This is diabetes mellitus. This is diabetes mellitus. And this is small left foot ulcer. Okay, augmented your foot. And second one is regular daily. This one also you can give. Okay. This one also you can give. This you can write in the third sentence. Regular daily saline dressing changes have been provided. So here, in addition to this one, okay, you have given regular daily saline dressing changes. They were provided. This for what? For the same thing, infected left foot ulcer. This was noticed during the hospital, not at home, not at the time of admission. During the hospital, it was noticed. How do you know that? Yeah. Next one. So that is saline dressing changes. This you can take third point. Or you can join both of them like that. Okay. First write about treatment medication for diabetes mellitus. Second, small foot ulcer on her left foot. That is medication. Then dressing changes. Right? Right. Next, fourth point. You have been regularly monitoring, and this monitoring should be continued. Okay. So this is regular monitoring, ongoing management and monitoring, care and monitoring. For what? For the wound. For the wound complications, monitoring for any signs of complications. Okay. She. Avoid this she. Okay. Avoid this she. A small ulcer which was developed on her left foot responded well with antibiotic therapy augmenting your foot and regular daily dressing changes. Finished. So write it. Additionally, right, second one, augmenting your foot, antibiotic therapy. This is the second point, antibiotic therapy. Antibiotic therapy is the second. Third one is dressing changes. Saline dressing changes. There's the third point, third sentence. And now, right? Ongoing management and monitoring. For what? For any complications. You have to notice so that something wrong may not happen. That's the next one. Now this one, you write next sentence, next paragraph. Okay. Next paragraph. Miss Bell retired from a manager position. This is social history. Social history. And has not found it easy to establish a routine in her retirement. Okay, this is her position, social history. You can write in the next paragraph. Okay. Then she would benefit from your help in monitoring her medication, monitoring, blood sugars, alcohol intake and diet. It might also help, okay, to introduce her to some ways of expanding her social activities. So this last paragraph, you can write what she has to do. Okay. So now, here there are points. Yeah. See here, medication compliance, blood sugars, alcohol intake, diet. These four things. So 5 points. Okay. 5 points you can write. 5 points you can write. Fifth paragraph, fourth sentence. Okay. So income, she has retired and income is less. So you have to establish income generating activities. Then establishment of social activities because she is lonely. She feels bored. She needs somebody. So participate in some social activities to keep her away from isolation because she is living alone. She has no friends. She has no family. Okay. So let her be involved in some activities so that she will not think that she is alone and she will not feel bored. Okay. An overall lifestyle plan should be changed. Right. Then social worker is needed. This is the last paragraph. Last paragraph you can write. 5 is the body. In the body, 4th paragraph. So you can write this one. Okay. So now you can notice these points. No other interest. All these things are not that much important. Okay. Now here, her lifestyle. Alcohol intake has increased. Dietary quality has decreased. Increased alcohol consumption and deteriorated dietary quality. Okay. So now we are going to write this since retirement. Since retirement. Okay. Since retirement. Let us take these sentences. This one. How we will write this sentence? Okay. These sentences. How to modify this sentence? Okay. This is 3rd paragraph. Let us take this one. Since retirement, alcohol intake has increased and dietary quality has decreased. This is gone down. It's a problem. Dietary quality is good, but decreased. It's not bad. Alcohol intake. Okay, somewhat okay, but increased is increasing. This is also a danger zone. It should not increase. Now, this is the background since retirement, comma. This is called the background. Background. Background since retirement. Then this is alcohol consumption. This is talking about alcohol. Okay. And this is talking about diet. This is talking about diet. So 3 points are there here. Since when? What increased? What decreased? She was retired. After that, alcohol consumption increased. That means before also he was taking, but now it increased. Dietary quality, earlier he was okay, now it decreased. Earlier alcohol intake was okay, dietary quality was also okay. Now alcohol intake increased, dietary quality decreased. They are contrasting. So since retirement, during the post-retirement phase, I am changing it. During the post-retirement phase, change, write whatever you want to write. Right. So since retirement, I change it to during the post-retirement phase. Okay. Right. Okay. Not only increased alcohol consumption. So not only increased alcohol consumption. Okay, that is one. Not only increased alcohol consumption, that is one. But also deteriorated dietary quality. Okay, so not only but also we have used here. We have used here not only but during the post-retirement phase, not only increased alcohol consumption, but also deteriorated dietary quality. Have been notified, observed, okay, informed. Have been observed, notified, informed. Okay, see the sentence, how it improved. How to write the sentence is more important. Same words which we have taken, changed here already. Increase. Alcohol intake has increased. Increased alcohol consumption. Dietary qualities has decreased. Deteriorated dietary quality. I have changed style, everything. Have been notified. Okay. So how you are going to write these sentences is very essential. So take one point and write sentences like this. So I hope you understood. Okay. So next one. She would benefit from your help in. She would benefit from. So now this she would. Why she? She would benefit from your help in. So why do we need this? Instead of that one, just write like this. Regular monitoring. Remove her. Regular monitoring of medication, blood sugars, alcohol intake, and dietary regimen would be profoundly beneficial. See how the sentence has improved now. She would benefit from your help. Your help only. Why not my help? Regular monitoring of medication, blood sugars, alcohol intake, and dietary regimen. Regular monitoring would be profoundly beneficial. It might also help. Again, why it might also help? Why that help is repeating? Okay. So this one will change it to like introducing some ways, opportunities okay, introducing opportunities of expanding social activities. And engaging in moderate exercises are recommended. As her income has decreased since her retirement, okay, she might be encouraged to undertake some income producing activity. Okay, income producing, generate income. Okay, now let us see the sentence here, case notes here. Income, small pension, less than pre-retirement income. Before retirement, what is the income? Now small pension is there. Okay. She relies on, depends on, okay, meager income. Okay. So, as her income has decreased since her retirement, she might be encouraged to undertake some income producing activity. Okay. So, now see here. This sentence is related to here. Suggest establishment of income producing activity. Okay. Establishment of income generating activities. Okay. Participation in, establishment in, introduction to income generating activities. Okay. Financially stabilizing activities. Financially strengthening activities, income generating activities. So you can write, change, modify in any way. She survives on meager pension. Currently surviving on a meager post-retirement pension is extremely difficult. And therefore, establishment Change it. Okay, change it. Involvement or participation or enrollment in income producing activity, income generating activity, establishment in activities which provide financial resources, modify, is suggested or advised. Yeah. So this is how making sentences. Right. So this is how you can follow it up. So now let us have some feedback how well you understood. You can write this letter and submit. Even doctors also you can write, no problem. Write it as a doctor. Okay. To a nurse. You are discharging. You don't have a nurse, so you are only writing a letter like that you write. Okay. Now start from the beginning. A. Ahmed Abdullah. 1 second, please. I'm unmuting for everyone. Ahmed Abdullah.
Yes, sir.
Yeah, give your feedback. How was the session? What did you learn? Was it useful or it's a waste
Yes,
of
very
time?
useful actually. I first time to attend this letter organization and writing, and it is very clear and organized and scientific terms and manner and good English vocabularies and organization. Very nice. Thank you very much.
Yes, thank you very much. So did you learn anything new here today, Mr. Ahmed? You
Yes,
are a registered student, you are a doctor working in Saudi, and you are a regular student, you are registered last batch, and I'm proud of you. You're attending the sessions regularly in spite of your busy schedule. Okay, but many students, they don't feel that this is very important, they don't get time, but that's their adjustment, they have to adjust. So why do you think these sessions are important? Can you tell me? Next, Muhiba, Dr. Muhiba.
Yes.
This is a letter for nurses. Many nurses don't want to attend, but you are attending. Seriously, you are attending. Why did you attend from the session from the beginning till the end? How was
Yeah,
it useful?
it was very good. However, I haven't done any letter for you, but just I learned lots of instruction from your teaching. So I learn a lot now how to because the main problem is there was the language, not the language, however, or the how to write in correct places. So paragraphing is very important, and I learn now. Thank you. And even one thing I learned, it was about the name of medication, which was the brand was important. I didn't know that before. Never I used that one. All the time I was using the, especially for the nurse, doesn't matter, but metformin, for example, I never saw the bracelet inside the bracket. So we should put that one, but now I learn, and I made some note as well.
Yeah. Next, Deep Gill, Ramandeep Gill. Ramandeep Gill. Yeah, share your experience, Ramandeep. Okay, Chaitra. 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 Then Girija. Mahesh,
Yes, sir. Good evening, sir.
yeah, good evening. How was
Sir,
the session?
your
I
session
think
is,
this is the first writing
yeah,
session.
yes, sir. It's very nice session, sir. I also learned how to construct and paraphrase the sentences. And I also have a confusion about what to write about medication, like trade, brand name or a chemical name of the medication that I have learned today.
I think you have a very big question. Why Simon Shah always shouts in the class, right?
No, sir, I don't have any question, but I feel good, sir. You have shouting and telling such thing like this also help us to learn in good way, sir.
Actually, I'm not teaching, I'm brainwashing because people have wrong notions, no? I'm setting them right
Yes,
by
sir.
shouting, that's all.
Yes, sir. Yes, sir.
Okay, next, yeah, Girija.
Yeah, good evening, sir. It was a superb session. And the sentence formation and all, I think I learned. I think it was very good, sir. I learned new things from this session. Overall, it was superb, sir. Yeah. It was very useful, and that the difference between the generic name and the brand, we were not aware of that. I was not aware of that. Thank you very much, sir. Yeah.
That's very good, thank you. Then, Ansam. Ansam, are you a doctor or nurse?
Nurse.
Okay. Yeah,
It was very useful lesson, and I learned a lot of how to write the layout of the letter, introduction, and how to write a nice paragraph. Yeah, yeah. I think the overall is very helpful and very useful as well. Yeah.
yeah.
Thank you very much.
So you asked for regular subscription, so you can contact me. I'll definitely consider you because you are a serious student. I know I have seen you 2-3 times earlier also. So you can consider. Only serious students I'll be taking, not many students who join. But I'll see, observe who is really serious, who is attending fully, or they are regular or not. That then only I will consider them. So because I have seen you quite some time, and that's why I give you an option. You can request me. I'll see.
Okay, thank you very much.
Next one. Raman Santhia Kunjumon. Santhia Kunjumon.
Yes, sir. Good evening, sir.
Good evening, Sandhya Kunjumon.
Yeah. Yes, sir.
This is the
I'm
first time
Sandhya,
you attended my
nurse
session,
by
right?
profession. Yes, sir.
Uh,
It was a nice session, and in this, everything you mentioned, it was a warm-up session also. I will tell. The 7 steps also I wrote whatever you told. I made the notes also. So I will follow the your classes, sir.
yeah, definitely, definitely.
Yeah. Thank you,
So
sir.
you can request me. I'll add you in one of the groups. And if you are interested, you
Yes,
can
sir.
contact the regular sessions. Yeah, Mahesh.
Okay.
Sir, I have one doubt also.
Yeah.
I
Oh, sorry. Yeah.
Sir, I have about a doubt about one link you share in the group, sir. That is a Cambridge dictionary.
Yeah.
Hello.
Yeah. Tell me.
Yeah, sir. While searching any words, it shows like ungradable B, C. So, what is the meaning of that for particular word, sir?
ABC. Ah.
Yes, sir.
Okay, I'll show you. So Cambridge Dictionary. This is Cambridge Dictionary.
Means it is like
For
formal or
example-
informal word.
For example, diagnose. What is the level of this word? It is C2. That means if you use a C2 vocabulary, you will get A grade in vocabulary.
Okay, sir.
If you use C1, then you will get B plus or B. C2 vocabulary means your grade is 450 plus. C1 means 350 plus. 350 to 449. C2 means 450 to 500. B2 means 300 to 349. That means C plus. So that is called CEFR. Called CEFR level. Okay. Those are called CEFR levels. CEFR levels. And OET. So this is CEFR levels. Okay. If you see the CEFR levels, these are your grades. This is your CEFR. If you use C2 vocabulary in Cambridge Dictionary, you'll get 450 in all the skills. If you use C1, you'll get 350 plus to 449. If you use B2, you'll get 200 plus, 200 to 349. B1 is even less. Now you understand, Mr. Mahesh?
Yes, sir. Yes, sir. Sir, I got it.
This is the power of vocabulary.
Yes, sir.
The more you
So we
use
can,
it,
sir, we can make
better
like,
your skills.
yes, sir.
You have to use more C2 vocabulary and more C1. If you want to get B grade, if you want to pass, you have to use C1. If you want to get A grade, you have to do C2 vocabulary. Now is that clear?
Yes, sir. Yes, sir.
More of C1 and C2 vocabulary you have to use. And you can go to Cambridge Dictionary, or you can go to Telegram channel and just open our classical correction, and there you check. Okay, Cambridge, just type Cambridge and you'll get all
Yes.
the words. Yeah.
Yes, sir.
Here,
Thank you, sir.
type Cambridge. All Cambridge vocabulary you will get here. Complement. This is C2 vocabulary. And it will take directly to Cambridge Dictionary. See, complement is C2 vocabulary. Thank you for your compliments. You can tell the patient. You are very patient and kind. I appreciate. I want to give you a compliment that you are patient and kind. Generous. Generous is B1 vocabulary. Generosity. Generosity is B2 vocabulary. Okay. Claim. Claim is B2 vocabulary. Then refer. 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 Okay. Medical refer. Okay. Refer. C1 vocabulary. C2 vocabulary. To direct someone or something to a different place or person. This is, you see, for information, help or action. This is C2 vocabulary. Use the word refer. Okay, use the word refer, like referral letter. So C2 vocabulary, diagnose. Okay, diagnose. Regulations. You have to know what type of word. Regulation is B2. Okay. Systematic. Systematic is C2 vocabulary. Use systematic. Systematic is C2 vocabulary. That means you are very systematic. According to the agreed set of methods or organized plan, your treatment plan is followed in a systematic manner. That means you are compliant with medication. Comply. Comply. C1 vocabulary. to act according to an ordered set of rules. Compliance, medication compliance, formal. That means C2, more than C2. Okay. Complications. In order to avoid complications, C1 vocabulary, use such words. Okay. Then next. Yeah. Who else is there? Amber Amin. Hello, Amber Amin.
Hello.
Yeah, Miss. Yeah, Amber.
Yes, sir.
Yeah. Can you introduce yourself? Where are you from and what is your profession? Can you share your experience?
Hello.
Yeah, carry on.
You're here, me?
Are you a
Hello?
doctor or nurse?
Nurse.
Okay, where are
Sir,
you from?
I'm from Pakistan, Lahore.
Okay, share your experience. How was your experience today?
Sir, it's really grateful to have your session, and I really waited for your class or session. It's really helping. I have learned many new things related to drugs or generic names. As the uh, company name or brand name is more important. I don't know about that, and many things which I learned in your session. Thank you so much.
Yeah. Amber Ansam. Ansam has been attending regularly. And who is that? Amber Amin. You also attended 2 or 3 sessions, right?
Yes, sir. I have.
For both of you, I'm giving a special discount. You can contact me. Others, they have to pay full fees. Because you are regular, I'll give you a special option. You can contact me. Then next,
Okay,
Principal Mafu. Mafu.
Yes. Hello.
Yes, please. Hello.
Yes, I'm a nurse.
Yeah. How was your experience with this class?
Wow. It was very great. I really appreciate. I learned a lot on the 7 components of the writing task, where we should write the dates and the other stuff. Because sometimes I used to write it on top, like the date before the address. And then also on the selection of the notes, I really learned a great thing there, because sometimes we put unnecessary notes that will make us lose marks. So I really learned a lot on the importance of selecting proper notes when we are writing. The notes that are really relevant to the type of the letter that we are writing.
Yeah.
Yes.
So that's very good. That was a wonderful session. I appreciate for your patience and kindness. So that's the
Thank
end of the
you.
session. And every
Thank
day
you.
we have a session for the nurses at 8 o'clock every day.
Yes,
And the
sir.
doctors will have a session at 9 o'clock every day. Doctors,
Okay,
9
thank
o'clock
you.
every day. So
Thank you.
I'll give you the schedule. So both doctors can attend nurses can attend doctor session, because we are learning letter, sentence structures, grammar, vocabulary, organization, presentation, passive voice, active voice, avoiding personal pronouns, avoiding redundant information, avoiding irrelevant information, using relevant information, organizing the sentence, joining, combining sentences, synthesis of sentences, simple, complex, compound sentences, avoiding active voice and using passive voice. Okay, avoiding personal pronouns and using the subject instead, and improving the quality. So we are going to learn a lot of things. So that's the end of today. Have a nice day. Yeah. Right, that's fine. Good night.
Now